All right, now to a possible fourth dose of the COVID vaccine. The question is one needed? And more importantly, will it work? The latest study out of Israel says a fourth shot could still leave you at risk for the contagious Omicron variant, but the vaccine's still protected against severe symptoms and hospitalization. Dr. Monica Gandhi is a professor of medicine of infectious diseases at San Francisco General Hospital, and she is joining us live once again tonight to help us understand the latest data and information. All right, so let's begin with the fourth dose. Is it needed? Will it work?
So it's probably not needed. It won't work. And actually, to be honest, it may not be the best thing for the immune system. So just very briefly to explain this, we basically generate from the vaccines what are called T cells and B cells. And then we also generate antibodies. It looks like Omicron evades our antibodies. The third shot definitely helped, but a fourth shot doesn't do anything else. But the T cells and the B cells, they're so important. They will save us from severe disease. It's why they're there, actually, and antibodies are more mild disease. So we don't need it. And beyond that, there's something called original antigenic sin, but you don't want to keep on boosting with the same old strain of virus for you to be able to respond to new strains.
All right, I hear you loud and clear. Not needed, won't work. So I'll move on to my next topic, and that is, has Omicron peaked? I know you and I have talked about cases focusing on hospitalizations. You watch the numbers. Have we seen the top of this?
We're getting there. So Northeast has already peaked and coming down. Boston wastewater that everyone was staring at so avidly has already peaked. And now the cases are coming down. Here in California, we peaked in wastewater about a week ago and about 4 days ago. And that means a week from then, it's going to peak. So let's say 3 more days will peak.
Okay. Good news.
Yes, good news, because this has been hard.
Yeah. The other thing I keep hearing, Dr. Gandhi, is this idea, and I call it the chickenpox theory, but I know that's a stretch, but of people trying to get the Omicron variant because they hear it is less severe. I have heard cases, anecdotally, of doctors saying, if you're going to get one, this is the one you want. What is your message?
So I would say that was true of chickenpox when we didn't have a vaccine. I don't think any infectious disease doctor is ever telling anyone now to get an infection because we have the vaccines. However, if you get it, it's going to boost your immunity, but I wouldn't encourage people to go out and get an infection, no.
All right. I heard you loud and clear. Always good to talk to you, Dr. Monica Gandhi. Thank you for joining us.
Thank you.
All right. Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.